Hello, I'm here today doing this presentation on the importance of stories and the individual's perceived experiences of their care. I have no conflict of interest over this presentation, and I'd like to just briefly go through the objectives of this presentation. It's really to raise awareness and the importance and the impact that healthcare requirements have on an individual. And this is going to be through examples that I can share with you. And I hope that it makes you realise that we all need to listen to the individual in our care to enable us to improve care. When we look at person-centred care, to me, it means looking at the whole individual. Whether it's from a baby in the neonates, it starts to the infant, the child, the teenager, through to transition from teenager to adult, and also, most importantly, the family, because they are an important part of our care delivery journey. And we should always recognise that everyone has emotional, mental, physical and spiritual needs, but plus financial needs as well, especially if it involves an adult or a child needing to go to centres of excellence or to clinics that are far away. And not everyone has a car, so they might have to get buses and trains wherever we live in the world. But also, one should always deliver care with dignity and respect to that individual. And to me, involve the individual, empower them to become stakeholders in that care delivery that you're going to be undertaking for them. Vital. Be advocates as well, most importantly. I'd like you to just reflect for a moment on your own experiences, or have you had a loved one who's been into hospital or a clinic and needing requirement of care? And no matter how old, regardless of age, education, and how stoic, one often feels helpless and powerless when you're experiencing pain. And I am sharing this emotional journey with you of someone who actually was finding navigating clinics and the hospital procedures really complex. But also, due to shift changes, lack of continuity, and you might see a nurse or a doctor one day, completely different team the next day, and that was very stressful in itself. So that again impacts on the individual that's sitting in a bed or a chair or a waiting room. So it means, that we've got to look at how they feel they've interacted with us. Being at the centre of care, so what does that mean? Well, everyone feels vulnerable at some stage of their lives in a clinic or hospital setting. And we need to try and make sense of what makes that individual feel that what they're going to undertake is right for them. But the individual experience here is often bewildered. And we should ask and hear and listen to their story. And you can see the compassionate communications cycle: listening, acknowledging and informing. 3 key areas of important care delivery to ensure that person-centred care is being met. And also, when you're listening to an individual to reflect on their experiences, it forces us to reflect on our own care. Have we done the best? Have we, heard their emotions? Have we allowed them to express their fears? Have we allowed them to be part of their care delivery package? For me, everyone has a story to tell, regardless of age. I did a lot of work with a clinical psychologist on patient stories, and it's amazing what one learnt from it. And they've never been academic enough to undertake massive research. Yet, we have to involve people, we have to listen to them, we have to, again, because to them it's a critical chapter in their lives. It's an experience that could be very good or horrifically harrowing. And that will always stay with that individual throughout their lifelong journey. So we do need to have that as part of our integral part of our assessment and care delivery, regardless of disciplines, and we should all be a multidisciplinary team working together in ensuring this happens. So, telling a story in clinical practice, what does it mean? Not listening to an individual, for me, you can see clearly states disregard for their entitlement to our professional expertise, service, and leads to negative outcomes. If you look at the chart, it's observational, eye contact, allowance, awareness, and energy to give that individual in our care, who so many are dependent upon us. And we're all going to become a patient at some time in our lives. And regardless or not, we hope we have a good experience, but for many, it's a very poor experience. When you're not listened or heard, you're emotionally and physically distressed, you lose trust and confidence and terrified to go back to that particular area of expertise. Regardless of the fantastic expertise there, if you have a poor experience, it's terribly daunting and frightening. And these are life stories that I'm relating mentally in my mind too. And not being in control, losing control. And those are people that know me like to know that I'm quite bossy. But, you know, there are times when the moment you sit in front of a GP or a doctor, we become passive. We just sit there. Well, this shouldn't be happening. And that can all lead to poorer health and clinical outcomes, but also quality of life. We need to understand and never, ever underestimate the individual's level of understanding. We should not assume, but we should explore and ensure that they have understood our message. And also the participation and the importance of stakeholders, making sure they become such a part of a team. That's vital. So being listened to and heard, well, we all have stories to tell, whether it's from childhood, adult, teenagers, first love, or care or experiences in universities and colleges. We all have a story. It's no different when you're in a hospital. You have a story of your life to share. And they have unique experiences. And the more you listen and hear, the more you want from the individual, the exploring of their emotions and their tales, but always respect that they will only tell us what they want to tell us and what they're comfortable with, because it is memorable and very personal to the individual. And the nurse's contribution to the process is to respect the nature of the story and revere the storyteller. It's a dynamic process, and if you look at these two photographs, they're all engaging. And, you know, those two ladies are obviously in deep conversation about something. And the nurse there with two people really engaging. The eye contact's there, the body language, everyone's happy. But it creates pathways, but it requires energy and attention and time for us to focus fully on that individual as he or she is sharing their story, because to them it's vital that they cascade that knowledge to you. And I think Hawkins' work of the 5 minute is superb. And as she states, to give an individual the impression you could spare them an hour and yet to make them satisfied with 5 minutes is an invaluable gift. And that's a gift that we should all be trying to strive and provide to those in our care and their families. But time to talk and listen, have we got it? And I think this is harrowing. And I will read it too, where this poor lady said, if a doctor or nurse has sat down next to me and asked, what are you thinking? Or, how are you really feeling? I would have been able to have said that I felt trapped in a nightmare, that my life seemed ruined and death appeared a viable option. By expressing these emotions, I would have felt less isolated, less stigmatised, and a lot better. That's the power that we can enable people to feel valued and have a story that they're telling us listened to and valued. The purpose of asking questions is very clear here. We need to empathise and allow the individual to feel they're being heard. And it sounds to me that this wound is really getting you down. You feel it will never heal and you won't be able to go out with your friends to bingo again. That to me demonstrated a strong empathetic understanding of the person's actual journey and their day-to-day experience. That to me is good listening and feeding back that you understand. But it does require effort, time and commitment and the attention. But it also demands a high level of identifying the person's feelings. And this, I took this photo. It's a lovely photo, and you can see the nurse really engaging, not only with the individual, but with the husband as well. And her hands are there, she's talking, and she's really engaging with that individual. Such a powerful photograph. And we should look at photographs and think, yes, that is person-centred care. Everyone has a reaction to tell you about, recognise their fears, their confusion. A lot of people are confused about what's going to be happening to them and are very vulnerable and dread going back to see a consultant specialist because it might be bad news, or they will relate to you how they dreaded and express it. And also we must never make assumptions, assume or reassure inappropriately. It has to be explored. When I look at the summary of it, I think this wound management across life's continuum is a very powerful message from, birth to death. And we really need to look at our own practice. Have we achieved the right level of engagement and ascertain the person's experience of care? Have we really empathised, valued, listened and heard? And do we understand, and how can we improve our own care and communication skills to the individual and their, because it is a partnership. And listening means learning not to reassess too quickly, and to advocate for people in our care, we need to ensure the evolution of our own communication skills so that when we're listening, we fully understand the narratives that the individual's imparting to us. So in conclusion, as a multidisciplinary team member, we need to recognise that every individual in our care, young or old, has a story to tell. The fact that we may not hear their stories is only due to our extremely poor listening skills. The references are there, and thank you so much for listening. Thank you.